I think the new bill intent is embraced by many providers. I think the sector, the independent sector, embrace the opportunity for more plurality and more contestability. I think the biggest challenge is how do we get to that intent? How do we get and achieve the policy intent and the time frame that we're working to? And the transitional arrangements, I think, are being challenged, and there's a potential that we won't end up with the outcome that we want because at the start of that transition, we're not optimising in order to achieve that.
Is it the transition in terms of the backup team for the consortia that bothers you in the first instance?
A consortia configured of GPs needs good advice and support in terms of the setup of their new organisations that will commission services going forwards. They will be a legal entity, a statutory body that must be configured, have governance and systems in place that allow them to make informed decisions and contract with a cross-section of providers, third sector, local providers, public providers as well as private providers. In order to do that, any organisation needs to have the right structures in place to give the confidence to that party that they are a legitimate party to do business with. At the moment, I would question whether those organisations are getting the support and advice and counsel of the options open to them. Should they be a limited liability partnership? Should they be a limited company? Should they be a social enterprise? Is the funding available to them for them to spend to optimise that now? And I think the answer is no. The potential, therefore, for one to inherit the former structures and not have considered what you could be is limited. That's not to say that PCT colleagues shouldn't work and support the delivery of those commissioning vehicles, but it's also not to say that they shouldn't consider what should change. And if you're getting all of your advice from your former PCT, there's a risk that you won't get the outcome you want.
Some of these consortia have to be up and running within 2 months. How concerned are you that that simply won't happen?
What do you mean by up and running? In 2 months' time, they're shadow organisations. The PCTs, for want of a better description, controls the purse strings. The PCT will transition arrangements, contracts, systems and other across to these organisations over a period of time. But as a shadow organisation sitting on the council of a GP consortia, you are now accountable for the budget and the care outcomes for the area of which you have jurisdiction. If you don't understand what you've inherited in terms of contracts, what you've inherited in terms of budgets, and categorise those against the disease categories and care requirements, you don't know on day one whether you'll be bust on day 6 or day 60 or day 360. That's the challenge you have. So I come back to the point again. I think it's achievable in 2 to 3 months if PCTs and strategic health authorities support those new consortia with good advice in a structured, templated way to support them through their thinking, so they know what they're inheriting and then they can support commissioning going forwards. But not from day one, but they need to understand at the starting point. There is a danger that you leap to the end point without actually understanding what you've got.
And how confident are you that that'll happen?
I think it'll be variable.
And if it is variable, what could the effects be?
If you do the same on outset as you've inherited, the potential to deliver the same outcomes, structures, delivery mechanisms will be in place. So it, in some ways, is self-fulfilling. What will happen over time, though, is you will get a reference point of best practice that perhaps will reference to those that aren't as good for them to try and achieve it. But in some ways that would be underwhelming because you've missed the opportunity and you've got to wait for those benchmarks to come in play.
And from your own perspective, how do you welcome the prospect of the competition that this is going to throw up?
Oh, it's great. I absolutely think it's great. As long as it's level playing field. I don't think you need fixed contracts. You don't need a guarantee and underpin. What you need to know is when you enter into that tender, or you enter as any willing provider, you are not going to be treated for some reason differently to another. If the patient and the GP together can make an informed decision, that's all I would ask. If the independent sector or the public sector or the third sector is capable of joining up care pathways and improving outcomes for patients, great. And on merit, whoever should win, should win. My concern is that the starting point, by definition, is not level. It can't be. But the starting point can determine what happens going forwards.